Okay, welcome to week 3. This week we're going to have an overview of informatics and healthcare. You'll finalize your informatics project. You can start looking for supporting articles. You're going to write your final PICO question if you haven't already done that and submitted it and received approval of that. And then you're going to start doing your literature search for your articles to support your PICO question. So, informatics. So this really became an area of specialty in around 1984. And at that time, it was really just defined as the application of information technology into nursing duties. And so you can see it really was just the focus of education management and practice. In the mid-90s, the American Nursing Association presented this as a specialty. And so in this graphic, you can see, and you've seen this before, is that really looked at nursing informatics, and they blended nursing science, information science, and computer science into one to form this specialty for nurses. With anything, within different specialties, and just even as a graduating nurse, you have competencies. And with the BSNs, you have basic competencies that you have to meet to be able to set for licensure. So when you think about informatics and in the field of or nursing informatics, when it first came out, it was really just based on computer skills, a little bit of information around informatics, and then just skills of being an informatist. And they really didn't start offering formal nursing and informatics classes until the late 90s. And that's when schools started to offering this as a certification as well as formal classes. So why the push? Well, if you can remember, around this time, 2014, 13, 14, maybe even far back as 2010, there was a big push in federal CMS or Medicare says, hey, all healthcare systems have to have electronic health records. And so ANA developed this position statement to support that. The federal government or the federal health system, they actually have an information technology strategic plan. It originated in 2015. It's a 5-year plan. I have not looked yet, and I should do that. As far as whether there's a new one from 2025 to 2030, but here is the link there. You can go and look at that. But it really did just outline the steps that federal partners can take to improve health through the use of IT. And it's very outcome driven. So you can see here in the graphic that it not only focuses on the individuals, but it's also focusing on the populations as well as caregivers. As well as healthcare providers. The payers are in here, which is our insurance companies, whether it's from a federal perspective or from a commercial perspective. It also involves public health, so our community health systems, researchers, as well as innovators and developers. Okay, this slide here just shows what we previously talked about, but this just goes into more explanation. But it really was putting the individuals first. So how were they doing that? And they really focused on that patient-centered care. And what does the patient think from a values, from what their culture included, their goals, etc. And you can, you think about what patient-centered care now, it's, personalized care, the lingo goes back and forth. It really focused on value as well, and that was not only from a healthcare system, but a patient perspective. So what did healthcare mean to them? What did quality mean to them? What does safety mean to the patient? What is affordability? What does cost mean? Something very different for all of us. And then there was this whole emphasis on building this secure access to health information. So thinking about patient portals and how patients now are able to do a variety of things. They can request records, they can request refills, they can request appointments, and we'll talk a little bit more about that. And then putting research into action. So really having the funding out there to drive research to improve patient outcomes. This is just what a snippet of the strategic plan looked like. You can see that there's, there was more than 3 goals, but this is just, again, a snippet of it. And you have your strategy up here, so promoting health and wellness, enhancing the delivery and experience of care, etc. And then they actually have their actionable items that they were actually going to focus on, or their objectives. And this is really how they were going to complete their goal, or to meet the goal. So, you think about from an IT perspective is, what do we do and how do we use that? Well, we use it to care for patients. We can track diseases. It's there to protect our public health, so we can see how many cases of, XYZ we have. And it's also used to conduct research. And ultimately, as I've said many times now, it's really to improve the health of our population. So what does this mean? And to us as nurses, well, we have to take all of these into account. Our healthcare system is more complex than it's ever been. Our patients are more complex than it's ever been. Access to care is harder. There's new things coming about from a federal and local level, different types of models of care. And we'll talk a little bit more about that next semester. But just a lot of variety of things that are happening, and doing this through access to technology, but there has to be funding. And we are the highest nation of healthcare spending, and why is that? And why do we have poor outcomes? So just a lot of things that we all have to think about. It's not just about doing the tasks that we do for our patients, but there's this bigger global perspective of what goes on. These are just a different way to look at this. There is opportunities in digital health, and it gives this patient empowerment. I said patients can do a lot of variety of things. It gives them a sense of control that they have and own their records. It also does this advancing interoperability. And how do we do that? We talked about, through the exchange of networking and care everywhere, and that's really about that. And then you think about just how we have integrated information systems into nursing. Well, we've done a lot of different things. We're not only, basically it was a system to collect patient information and house information, but you think about there's all different ways that we use that technology. We have nurse scheduling systems. Patients are able to schedule, cancel, request appointments. We have algorithms that set within our electronic health records that help define our population or find our population and say, this is the evidence-based care that the patient shall receive. We also have computerized provider entry. That's what CPE is. So providers putting their own orders in. And probably one of the best things that have come about through the years is the barcode medication administration, and being able to use a scanner to do that and increase or decrease, I should say, medication errors. When we think about as we've moved forward, the American Nursing Association has scope and standards of practice, just like they do for any specialty. And you have that for undergraduates. This is what the book looks like. Yeah, I know I'm a little nerdy, but I actually do read these things, and it's important because it's what drives our nursing practice. The other thing from a BSN Essentials is that through our accreditation and what we have to prove for not only to you as students, but for licensure, that there's basic elements that you have to meet and say that you're competent in. And there's 10 different domains, and the domain 8, is what informatics actually falls into. So, do we have informatics and technology integrated into our system? And it really should be done throughout all levels. And there are components of it, but probably in this class we speak to it more. The Q's and competencies you probably see more in the graduate programs, and then the AA or ANCC, or the American Nurses Credentialing Center, is actually where you can go. I mean, it's an accrediting body as well, but you probably are more familiar if you're thinking about certification that this is where you would go for that. So, why do I need to know this, right? Well, everything we do now is computer, and there's some sort of technology and informatics component to it. And as I've said many times now, it's really about the outcomes, and are we delivering safe, high quality, and efficient care? And are we doing that based on evidence and based on practice? but there's also a component of regulatory standards as well. So when you think about just clinical informatics, it's really about the application of analyzing, implementing, and evaluating. Again, it's all about these health outcomes, improving patient care, improving relationships. Now that can be defined in many different ways, but it's the integration of all of these things that we're thinking about to improve our efficiencies in our care for our patients. Then along came artificial intelligence, and this is probably the hot topic now, and how do we use it, and how do healthcare systems, and we're even thinking that internally here within Baker, and from a nursing perspective and our program perspective, is how do we use that? What kind of expectations do we set, not only from faculty, but from nursing students as well? You know, and just the use of GPT, and now that's been integrated into systems, and how do they use that? And basically, if you think about it, it's been there all along. They use it for forecasting and predictive analytics. So, you know, taking a population or taking data that's integrated into your system and saying, okay, this is what we think the healthcare system within your healthcare system is going to look like, or this is what your population looks like, and this is what the risks are of that population. So it's really interesting, but you're compiling a lot of information to obtain that data, or taking a lot of data to obtain that information. There's always a user component of any type of technology, and these are just the 4 different components from an informatics or a technology perspective, and it's really about understanding the interactions between them. But probably the most important one is usability. How easy is your system to use? You're not going to have a lot of buy-in from individuals if your system is so complicated that you can't use it. And it really should be effective and efficient, and to get the best outcome, again, for everybody. There's always some research component to everything that we do, and I could go with and we talk about it because it's a research class, but you know, lots of research has been done around technology, specifically to the electronic health record, but there's some things around effectiveness, optimization, you know, again, and how easy is a system to use. Lots of research out there and documentation and the burden of that. A lot of stuff around efficiency, satisfaction, not only from clinician perspective, but from staff and patient perspective. And then taking everything that we do as nurses and then documentation thereof, and putting it into some meaningful information that we can act upon, whether to change practice or identify gaps in what we know today. So that's, in a nutshell, is what it's all about, and it's going to evolve over the years. I think it's an exciting field to be in if you're at all interested in it. It's you know, most organizations have some sort of information system department, and they send you off for training, and it's really cool, and you get to go to cool places. You can become certified in it, and it's amazing. So here are your dates for upcoming assignments. I know that some of you have already been working on these. Again, if you have any questions, please reach out. And again, it was exciting to see you all this past week, and I look forward to seeing you again, and take care of this week.